AFib, which is a common form of irregular heart rhythm, is a leading cause of stroke. And now there's a free virtual study for older Americans that allows them to manage their heart health and contribute to important research on AFib at the same time. Now, they need an iPhone. And joining me live are cardiologist Michael Gibson and Dr. Paul Burton with Janssen Pharmaceuticals. Gentlemen, good morning. I'm going to go right into my first question because I think we have a little bit of a delay with you guys. Dr. Gibson, let's talk about this Heartline study. How does it work, first of all?
Well, it's a nationwide study that anyone can participate in if they're 65 years or older and have an iPhone. And what we're doing is this. 6 million people out there have that irregular heartbeat called AFib. 2 million people don't know they have it. We're trying to use this app, and in some cases, some people will receive an Apple Watch, to see if we can detect 2 million cases of that silent irregular heartbeat. The goal is perhaps we can find some of that irregular heart beating, and perhaps we can reduce the risk of stroke. Keep in mind, 1 in 7 strokes are due to this irregular heart beating.
Dr. Burton, jump in here. Let's talk about why AFib. Why is it so hard to diagnose?
Yeah, Angela, so atrial fibrillation, a regular heartbeat, is so often asymptomatic. So people walk around with it, as Dr. Gibson said, 6 million people here in the US with it, but don't know because it's asymptomatic. But it's easy to diagnose. You can use the Apple Watch. It will detect an irregular heartbeat, and that underpins why we're doing the Heartline study.
Yeah, Dr. Gibson, do you have to have AFib to actually take part in the study? Is that what you're looking for? Are you looking for people who maybe don't know they have it to take part?
You don't have to have AFib. In fact, if you don't have AFib, we're seeing, can we detect it? So no, you don't have to have AFib. You can have AFib or not have AFib to participate. If you think it might be for you, go to heartline.com to check it out.
Yeah, that's what I think. People, my father, who's older, he's actually had a heart attack in the past. Not that that has anything to do with this, but he doesn't have a cell phone. He still has a flip phone. So it sounds like either one of you can answer this, but it sounds like you just need to have, is it an iPhone specifically, or what is the specific piece of technology you need to have? And Dr. Burton, why don't you take that?
Yes, Angela. So you need to have an iPhone, an Apple phone, 6S or newer. You then go to heartline.com. It's very simple, straightforward, randomizes you into the study. You can then purchase at a very affordable price a Apple Watch, or if you don't want to purchase it, there is a no-cost loan option. So easy to get into, and the feedback from the people in the study so far has been great. They love it. It's very engaging. A great heart healthy study.
Dr. Burton, Dr. Gibson, we sure do appreciate both of you joining us and letting us know more about this and maybe help save a lot of lives in the future.
Great, absolutely. Thank you, Angela.
Absolutely. If you'd like more information, you're welcome about this Heartline study. That's what it's called, Heartline study. Fox59.com/links, and we'll link you up to that. But, important research, things that we're still doing and being able to tell people about it, Jim, virtually.